Well, let's take you to Malawi, where the worst cholera outbreak to affect the country in 2 decades has now claimed 750 lives. That is according to the country's health minister, Kumbize Kandondo Chiponda. Chiponda on Thursday ordered the closure of businesses that lack safe water, toilets and hygienic garbage disposal facilities. The health minister also announced restrictions on the sale of pre-cooked food. The World Health Organization has described Malawi as one of the hardest hit globally, and it is among 14 African countries that have reported cholera cases since the beginning of last year. Many of the cases on the continent are as a result of flooding. Meanwhile, the World Health Organization has put at 31 the number of countries globally that have reported cholera outbreaks since January of 2022. This is a 50% increase compared to previous years. But what exactly is cholera and how can it be managed? CGTN's Joy Kiruki with the details.
Cholera is an acute diarrheal illness caused by infection of the intestine with the cholera bacteria. People can get sick when they swallow food or water contaminated with cholera bacteria. People living in places with unsafe drinking water, poor sanitation and inadequate hygiene are at the highest risk for cholera. Children, especially those under 5, are particularly vulnerable. Cholera can cause severe acute watery diarrhea and severe dehydration. It can kill within hours, even treated. It takes between 12 hours and 5 days for a person to show symptoms. Cholera is easily treatable. Most can be treated successfully through prompt administration of oral rehydration solution. A multifaceted approach is recommended by the World Health Organization to prevent a cholera outbreak. This involves a combination of surveillance, clean water, sanitation and hygiene, social mobilization, and oral cholera vaccines. Joy Kiruki Juma, CGTN.
Well, let's get more insights into the outbreak and the disease itself. And I'm joined by Dr. Angeli Kotzi. She's a health expert and former chairperson of the South African Medical Association based in Johannesburg, South Africa. Thank you for joining us on the program, Dr. Kotzi. Now, some 30 countries have reported cholera outbreaks this year. What is driving the surge in numbers?
Thank you and a good morning to everyone. So as Joy correctly showed, is the lack of sanitation. Sanitation, and because it's a waterborne disease, I think that is first of all extremely important. So it's waterborne disease, we need water treatment plants to be working properly. We need to look at sanitation. We need to look at hand wash. We need to make sure that the water that you use to clean your fruit and your vegetables are not contaminated. We need to understand that with cholera, there is a vaccine. Incidentally, the World Health Organization in November 2022 donated 2.9 million vaccines to Malawi. So you need to be vaccinated, especially if you are living in a high risk area. And if you look at the recent rains and floods in Africa, that will contribute to this problem. But again, it comes back to infrastructure at municipality level, where we know that there should be proper water and sanitation oversight from the people who is responsible in that specific municipality area. And then we need to teach the people out there, do not drink, do your washing, and use the rivers as part of a sanitation type of thing. It's not, you cannot do that. You cannot drink and do everything in the same water. And we also need to look at the cattle, what is happening there, how clean are those waters, and then what else except, vaccination, cleaning the water, what else are there in the immediate communities that one can give to them. There are tablets that you can use to purify the water, and they must do that.
So, Dr. Coates, you've mentioned a raft of things that people need to do to, to curb the spread of or to prevent cholera. But with global fatality rates rising, are we seeing countries, though, strengthening their capacity to prevent, control, or manage the disease?
difficult because we don't really see it. If there was good surveillance and the political will to really do something, we would not have seen an increase in cases. So, as I've already said, there must be political will, there must be the know-how, the knowledge at community level on how to purify water. And then there must be the most important as well, the education of the people living close to rivers or where there was recent floods. So are there emergency teams coming in? What did we learn? Didn't we learn anything the past few years of waterborne diseases? And I don't think Africa is really, they are trying. I know they're trying, but they're not really getting there. And here, it's important for the government of the day to take political will and to stand up and say, this is how it's going to work, and make sure that we get proper sanitation. And again, where there is no sanitation, vaccination, important, and then quick measurements like jig or bleach or any of those type of tablets, and the cooking of water, so that you can educate those people that don't get sick.